I'd like to welcome everybody to our COVID and Cancer series. We are thrilled that you're here today. And this is a topic that is definitely of interest to people on how to safely travel during the pandemic as a cancer patient. You have kind of extra concerns, traveling safely during the pandemic is certainly its own set of issues. And then traveling as a cancer patient, own set of issues. And so I know everyone has a lot of questions and ideas and concerns. And we were really lucky that Virginia Braster is here to join us. She is a travel professional. She's with KPT Travel, and she has a slideshow, and she's going to be available to us for the next hour to present to us, share some really great information, and then get into an ongoing interactive dialogue so that everyone feels safer, more comfortable, and inspired to take whatever that trip may be, whether that is, going to visit family locally in a car ride or taking a more exotic trip to a faraway destination. So, Virginia, thank you so much for taking the time to be here with our patients today. Welcome to our Woman to Woman.
Thank you. Thank you for having me.
Really excited.
Yeah, I'm really excited too. Thank you for having me. Hi, everybody. Like Rachel said, my name is Virginia. I've been doing it for about 12 years. I'm going to just present a slideshow of the things that I thought were probably overall for travelers, just as a safety precaution during COVID. I'm going to just show you that, and then we can get a little more specific into your needs and what you'd like to hear, because like I said before, it's such a broad brush. There's so much going on. There's so many different regulations, but they're kind of starting to tone down a little bit, and a lot of it's going to be your own comfort zone. So I'll just start with the slideshow. So my topic that I was asked to present to you today is called Traveling During the COVID-19 Pandemic. I'm Virginia. I'm a travel consultant. I work for my aunt who owns a boutique travel agency for the last 40 years. I've been there 12 years. I've traveled my whole life. I travel with a family of 6. I have a daughter who has both Crohn's, something called Bartter syndrome, and she's profoundly deaf. She wears a cochlear implant. So from a very young age, I've been very tuned into special needs travel. I also have a nephew who's autistic and Asperger's, and we've kind of had to, deal with medications going through airports and trains and wheelchairs and carrying your medical information with you. So I just want you to know, I know quite a bit. My sister is involved in the medical field. She's a social worker. I did a lot of consulting with her for this. As the slide says, I'm well versed in the COVID travel protocols, mainly because I had to be getting into this business. It was thrown at us in 2020, and we've been dealing with it. It's been interesting. We slowed down. There was no travel for a good year. I'd say a year, and then it started picking up very slowly. I just want to tell you my favorite destinations, just so you know a little bit about me. My number one is Italy, always. Costa Rica, I love. Paris and Hawaii, they're my go-tos. This is a recent trip I took, just so you could see that I traveled as well during the pandemic. That's my nephew, Alex. Like I said, he has Asperger's, he's autistic, he's on the spectrum. He's on a varied amount of medication. I met him in Houston for a trip, and we kind of had to navigate meeting each other. So that was fun. I had to talk to all kinds of TSA agents about him. So we just did that in February. A little bit about me. As mentioned, it's coming back strong, travel. It almost went from 0 to 100. Last summer, we saw light traveling, Christmas a little more, but then the Delta variant came up, and now it's very strong. You almost can't book things. Things are sold out. Rental cars are sold out. It's a funny time. People are comfortable traveling now. I think it just varies what's going on in the world. I don't know what the price of gas, how that's going to continue, but that's just a side note. It's hard. More travelers are fully vaccinated, some by force. A lot of cruise lines and tours like Brendan Tours and Trafalgar Tours, TAUC, they are requiring full 100% vaccination for travelers. They will not load a bus or a boat without being, fully. We'll get into the cruise lines later, but really across the board, those bigger companies want travel to come back. So they've had to do that. So it's almost across the board. You have to be fully vaccinated to go on any kind of guided tour like that. Most of the destinations that I deal with have very good support. Testing for when you come back into the country, medical facilities in case something happens if you're there, good health access. I mean, even in the Caribbean countries that I visited, and I've done a few this year, really, I tend to send my clients to destinations that are American owned. I don't mean to be like very, but like not just American hotels and such like that, or hotels I have a relationship, whether it's different owned, just because I know the facilities to expect from my travelers if I had to get them home. That's my first flight during the pandemic. That was me. Here are just my first thoughts starting now. You have to be cautious. You have to kind of take a step back and, is this trip necessary? Do I really want to go? And if you do, you start then with your plans. A lot of the hotels, cruise lines, everything, they're being very like safety, cleanliness, hotels, they're really being overly cautious. I mean, you still, when you get a rental car, they have stickers on the rental cars that when you open it, it's been sealed, it's been cleaned. There's still wipes everywhere. You're handed a wipe when you get on the plane. So it's good. It's still there. I would think if you're immunocompromised, like my daughter is, you take a little more into consideration. You just have to know what makes you comfortable, what your doctor's allowing you to do, what your status is on vaccines, what treatment are you in the middle of? So it's just some thought process before planning. This is another one of me in a very empty airport when I first started traveling. But now it's really more like that slide with the airlines. And actually, most airlines have dropped a mask mandate, but people are still traveling wearing masks. I mean, it's just something that's not going to go away. And your comfort zone is your comfort zone. So you do as you are comfortable with. So here's my tips, not to be so verbose. So if you can be fully vaccinated, that's the easiest way to travel if you can. I know some people can't be. That's just what your medical team seems, most comfortable with you doing. One of my big tips I got from my daughter's doctor when she was born and from my mom's doctor when she was a cancer patient and my dad is we did a whole list of conditions, medications, health proxy on a tiny little, as small as we could, laminated cards. We travel with them. I travel with my daughter's things. We just make copies, even like passports and things like that. We make copies, we throw them in our luggage, nothing to be, or you keep your small card of your medications just in case. I did this one bullet about the expense of getting bigger seats on the airlines. I only did that even on a train, even on a bus. If you're nervous to still be right next to someone that you don't know, I would try to get, I don't want to say the nicest seat possible. I don't want to be so, assuming that you want first class. It's just if you could be in a bigger seat kind of away from people, it helps. That's all. That's just does give you a little more space. You get to board early, kind of. If you're going on a car or on a guided bus tour, like everybody you're with, you have to be comfortable with. I know some people make fun when they see someone riding in a car with a mask. But if they have someone in the car with them, sometimes they're just being that extra step cautious. You don't know if that person's ill. You don't know what they've been exposed to, if they're a nurse or a doctor or a teacher. So whatever, I would just recommend, make sure you know who you're traveling with. Avoiding the areas with large crowds is kind of hard when you want to do a big trip. Like say you're going to Italy or you're going to France and you want to go to all these really iconic spots. You could still do them. You just might not be able to go to the most popular museum, or you might have to go to a time that's an off time in the morning, really early, or go to the Sistine Chapel at 7:30 in the morning, or maybe go to the Eiffel Tower at an off time when you don't think people are going at 7 o'clock in the morning, 8 o'clock. You could do it. It's just going to take a few extra steps if that makes your comfort zone. Typical medical things that I'm sure Rachel could back me up on with medicine is, avoid touching your mask after you go through airports, do your hand washing. Like I said, on all the planes and all the cruise lines and trains, they're offering hand sanitizer everywhere you go. They actually walk on the plane, they hand it to you. In the resorts and the hotels, I could show you video of when you get off your transfer to a hotel lobby. in these resorts, like in Mexico and the Dominican and Jamaica, they literally come up, they meet you, they put hand sanitizer on your hands, they give you a hot towel. So they are really trying to get people comfortable. I would say do a check, and also with your travel advisor, where you're going has access to care. Sometimes they have a health center. Cruise lines always have a really good health center. Most resorts have something. The airlines are pretty good. You kind of have to give a big look at that and make sure your doctor is safe in travel. Now, this last one, these COVID home tests are becoming very popular. They're monitored. You can travel with them, and you do your test while you're Zooming someone so they could see your real results. So people are buying them and taking them with them just in case. That's kind of it's a typical airport, how people are still. It does look like that, maybe a little more crowded now. Insurance. I thought about this. I always tell my clients, Rachel and I don't like to upsell anything, but right now, in the times that we're in, insurance is really important. It doesn't have to be the highest policy. A lot of you, when you have credit cards, they'll cover something, God forbid you get sick, but you can insure travel in case you test positive for COVID before you leave, in case you get sick while you leave, in case you need to come home. So travel insurance is a good way. I don't need to go line by line, but it's a really good thing to remember this year, especially. Destinations. You can go anywhere, you want. You just have to kind of, think what's most important. Safety protocols are in effect all over the world. They have different ones for different countries. No one's following the same. So I do a big sweep on where my clients are going and what you need to get into that country. Almost everywhere has lifted the COVID testing if you're fully vaccinated. If you're not, most countries have you do a test within 72 hours, upload it. I would recommend places like this. You have a lot of we have a lot of national parks in the US. You could be outside. You could be hiking and walking and boating. It's just nice. There's still so much outdoor dining. As noted, fresh air circulating, you're in a good shape, vaccinated or not, as long as you're comfortable, like energy level, doing things like that. I had mentioned here, like Iceland, Ireland, Costa Rica, Alaska. They're just places that, outdoor things that you could really be in a small group tour and comfortable. That they came to mind first. There's Ireland, Iceland, Costa Rica. They're all beautiful. They're all interesting. I mean, I can name 10 others, but those just came to mind first. And then on the flip side of that, I didn't want to be specific on my slide, but I wanted to be honest. And my honest opinion, as I said, cruising is great. I just would think if you're sick right now and there's still COVID levels, cruising could be a little scary because there's so many people. Areas with escalated COVID levels, you have to really check. The CDC has things posted, what's a higher level. They print numbers all the time. I really wouldn't recommend going on large tour buses where you don't know many people, but they do all have to be fully vaccinated for the better ones. You just have to really sit down and think, maybe I want to do this private. Maybe I want to do something a little more intimate with a smaller group. And then lastly, countries that have limited access to healthcare facilities, you don't want to be left in the middle of nowhere. It's hard, different places, different things. I can't be specific, but if you were interested, I'd definitely give you my honest opinion on that. United States entry. We're still requiring a COVID test to come into our country. If you're anywhere else in the world and you're coming into a port or an airport or a train station, border crossing, you have to test negative within 24 hours. That's where that BinaX test came in. I have been familiar, every resort I book, every hotel, they provide testing. They help my clients with testing. Some are charging for it now. It was free for a long time. Now it's become a cost. That's why that Binex test, we have a lot of people travel with it, and it's valid. Every airline takes it, the US takes it. So you upload your negative results. But if all else fails, you just carry that negative test with you. Also, if you've had COVID in the last 90 days, that's a valid reason that you don't have to test to come back in the country. You just need the positive test date and a note from your doctor that you are well enough to travel. It happened to me. I went to the Dominican Republic in January. I had COVID in December. I was allowed back in the country because I might have tested positive, but I was okay. And then to end it, some helpful hints. Like I said, the CDC website always has up-to-date things. There's going to be protocols. There's a company called Sherpa.org that gives very specific entry requirements for any country, any city. Any travel agent that you work with, including myself, should be able to have a short, long, medium conversation with you about the protocols. You might not know today, but we can find out. It might change. And I was thinking about this. You really, when you're traveling, you're best off kind of finding out what the state of getting into a country is now, or a state or a place, but then really a week out, find out exactly what's happening. They're changing every day. And that's what I think could be a good conversation starter. That's my email. If you ever have any questions, I'm here to help. So I'll leave it up to you guys. You could ask away.
Just waving your hand.
Yeah, I take injections of Lovenox, and I was just wondering can you bring them on the plane?
So when you travel with medication, you need to have the medication labeled and you need to show them at TSA, like your cooler. My nephew used to travel with syringes. He took syringe shots every day.
Yeah.
And we had to have it labeled in a cooler. You need to hand it to the security agent and they'll take it through for you. My daughter travels with meds. My daughter also has a cochlear implant. She has to take it off and hand it to the TSA agent. I did find out that there is a way, and I'm going to find out about it, that the TSA will give you a private security check where you're not so singled out. Like if you want to do that, you could pre-register, call a number, give them a card, and they'll be able to not clear you faster, but just kind of know what you're coming through with.
What
And
about
yes,
pills? If you have
Yeah,
take
pills,
well,
could
then
take
maybe you just put them in your pocketbook.
absolutely,
need-
that's fine. As long as it's a regular labeled prescription, you're fine.
Yeah.
You're not.
But as far as the injections, you need to show it to them.
Well, especially it depends on kind of ounces. It needs to be labeled and it needs to be in a separate carrying machine, like case, like a little cooler.
What if you don't need a cooler?
Then you just have it in a separate bag. As
All
long
right,
as
like
it's
a plastic
labeled what it
bag.
is. Yeah. And you
Okay.
have to take it out and you just show them when you get there. But I'm going to follow up with that TSA number. I actually had it written down it's like a special, they're not going to walk you through security earlier, but they will know that you could come. My daughter has to get a separate pat down and stuff, but they'll know you're coming with meds.
So they're prepared for you.
Yeah. And you know
Yeah.
what, when I do air tickets for my clients, there are all kinds of screens that the airlines, you could put in wheelchair requests and medicine requests. You could do special services. My daughter's deaf. She needs hearing access. She needs a flight attendant that can come over and notify her if something's happening on the plane.
And the other thing is you mentioned that about those tests that you take with you, I forget.
Binex.
We got them from the government. Are those the ones? They're okay?
They're not the
government's-
ones. The free ones are okay to take it home, but the Binex Now travel test is actually one that you can dial into a number and they'll self-monitor. Like they can see that it's you taking the test. So it's a
Okay.
specific Binex Now travel. A lot of people take them just to feel comfortable. They'll even test before they come home. You could take that test for your own knowledge, test before you test, kind of give yourself a test so you know what's happening on the next test. It's a live monitor. It'll be like me or Rachel monitoring the test.
Mm-hmm.
I get it. Thank you.
Yeah, you're welcome.
And I see her hand raised.
Yes. Can you talk a little bit about how insurance works? Because in the past, when we've taken out insurance, unless it was for that particular clause within the insurance, and if it was something outside of that clause, we were not able to activate the insurance. And that's my first question. My second question is there an airline that you like to use that you feel is more reputable when having to cancel a flight or make travel changes, or with insurance or without insurance?
Okay. That's a good question. Good two questions, because there's a lot behind that. Travel insurance is complicated. And at one point in my career, I said to someone, I can't believe I'm an insurance salesperson. Like, I don't understand this. Like, I have to take a whole class on insurance. I've learned a lot. Insurance is good to have to cover it. Most of them do not cover pre-existing conditions, but some of them do. And when you purchase it, you have to purchase it within 15 days of deposit on a trip. That's where the kick-in comes for pre-existing. You have to get that done, because some people, I don't know, I might cover it. You really, within 15 days, really have to decide whether you're taking coverage or not. That being said, they're all different. Insurance does cover the cost. They will reimburse you if you contract COVID. It's a medical reason. They're canceled. Most insurances are canceled for a valid reason: sickness, death of a family member, death of a traveling partner, bankruptcy, loss of job. So there's all kinds of stuff. You can't just cancel. But I work with some companies that offer cancel for any reason insurance. And that means if you wake up the day before and you break it now, you don't want to go, you don't go. You'll be reimbursed. Sometimes it's 75%. So it's lower amounts if you cancel for any reason. I work with clients, most people that cancel for a valid reason, sickness, like I said, loss of job, we get them back money, because if you buy a trial, you just have to file claims. It's a little bit of a pain in the neck. You get a doctor's note, like there's steps. Most of the time it's a separate insurance policy from AIG. It's not really through Celebrity Cruises. You just have to take a few more steps. I just got $300 back from a trip delay in January. I never thought I'd get it back. I filed it in February. Today, I got the notice, $300. So it does vary, and it could be complicated, but it does cover you for a lot of things: lost baggage, trip delay. If you get sick while you're away and you need to come home and you need to change your flight and it costs you more money, all that stuff should be covered. Travel insurance for airlines, you can include the air, but most airlines now are giving you that nice option when you're checking out. Do you want to insure this trip for an extra $30? And a lot of people are doing that. I would never sell a fully refundable ticket. They're about triple of what a regular non-refundable ticket is. That means you're buying a full $1,500 ticket because you want to be able to cancel at any time. You could get that ticket for $700 and just, if you need to cancel, reuse it, get credit. The airlines are still not charging change fees. They stopped that with COVID. You can still change flights for no fee. You might pay a different rate that the fare might be. You might have paid $500 last month, and now that flight's $600, but they're allowing you to change without charging you.
Do you have to have COVID to do that? Is that only
No,
a COVID change?
No. You can
Interesting.
change anything.
Okay.
Right now, every airline is allowing you to change at no change fee, but you have to pay the difference in airfare. They used to charge $200 a ticket to change. And when COVID kicked in and when they saw all this drama and all these cancels, they have now waived that. I don't know how long that will go on, but it's been really good. It's been good for clients. It's been really nice and easy to do air travel. My favorite airline is Delta. I think that they were the cleanest going into COVID. I have no tie to them. JetBlue was always good. I feel like it's a little bit of a sinking ship. There's a lot of talk about cancellations in flight, not being able to get pilots. It's sad because so many people still don't want to work. They've had a hard time retaining employees. They're good still. They're just not on my top. I would say Delta and American have done a very good job in COVID protocol, ease of uploading documents. That's just very personal to me. United, they're okay. They're good. They're out of Newark. I use them. The best airline's probably Emirates, but I've never flown them. But Delta is good. They're really very reputable to me.
Thank you. Greetings. Thank you. This is great. We're planning a car trip rather than flying to my mother-in-law in Michigan in July. Can you tell me about the requirements for going into Canada? Because we're going to come back through Canada. What their requirements are, at least now. It might change, but.
Yeah, Canada has definitely finally relaxed their laws. I can get very specific and email you if you want, because I do have access to something that would give you much more up to date. I could take your email and email you if you'd like.
Great.
I can share the exact, just because it'll be specific to today.
Mm-hmm.
And that way, I mean, they want fully vaccinated travelers, but if you're not fully vaccinated, you have to test to get in. My son's closest friend lives in Canada, and he's just finally being able in the last couple of months to come back and forth. But I can email you, Joan. I know it's definitely ease.
Shall I give you my email address?
Sure.
Then?
Sure.
jdragon87@earthlink.net.
Yeah, I'll email you as soon as this is over.
Thank you so much.
I have access to it's kind of a worldwide site that they update. They're most updated than anybody.
Wonderful. Thank you.
And driving is great too. We drove to Florida to see my son in the middle of the pandemic, and you just have to be careful in the rest areas. And I bring a lot of wipes in the car, just to kind of get you in and out of places. They're basically very clean. The United States, highways they've done a pretty good job. They leave doors open, so there's air circulation, and driving is good.
Yeah, thank you. And I'm embarrassed to ask this question, but I know I've received COVID tests in the mail from the government and through my husband's work, but I luckily have never had COVID, and so I've never used a text. So when you mentioned the IB Next, could you just give me a source for that too? Or
yeah.
What
There's
it is?
a company online. Well, it's BinaX. It's BINAX now, NOW, and they're travel tests.
Uh-huh.
I don't think you might need that when you come back from Canada. You do need it. It's a monitored test you can get on a site called eMeds, EMEDS. We have people buy them in 6-packs. They'll be good. The government tests are good. They are good for home testing. They take them most places, but to get back into the country, you have to have a negative, like a piece of paper or digital format on your phone. You can't just show them the test. So they've been really tried and true, the BinaX now.
Okay, great. Thank you.
Mm-hmm. You're welcome.
Virginia, we got an email just now from somebody. And actually, I has a question too, from somebody who is actually getting some labs done right now, so she couldn't log on. So her question is, can you ask about a trip to LA for July 4th weekend? Does it make sense to upgrade to business class? Anything else I need to be aware of? We're going to a wedding. I plan on staying masked.
I think staying masked is really important. And like I said, what I find is the hardest for people is almost like peer pressure. Why are you in a mask? What are you nervous? I don't have COVID, so I just think you have to be comfortable. I went away with a friend of mine who had never had COVID. We had, and we were vaccinated and boosted. So a lot of times I didn't wear a mask, and he did. And he did in a crowded like at a restaurant, and you just have to be comfortable. In the airports, you try to stay away from people. Not that you're major socially distancing. You're just not going to hang out. If you see a seat has 2 seats between it, I'd sit there instead of the seat next to someone. It doesn't have to be crazy, but you kind of stay in your own comfort zone with your family. Business class is good if it's affordable to you. Like I said, what I mentioned is, extra comfort. Main cabin comfort gives you a little more leg room. You pre-board. You don't have to touch as many things. Business class is that much better. You're with less people. And that's the whole gist of it. Is it worth it? Yes. You're I hate to say it, you're a little more taken care of. just getting on and being able to wipe down your seat, the whole thing. All the airlines are pretty good, but those that offer that kind of premium economy, that's how premium economy or business class. And I've flown in main cabin. I have a son that I've had to take back and forth to school. You just have to kind of stay by yourself. And if you're sitting next to someone, you don't take your mask off anymore. Like if it's not your family member. LA is okay because there's a lot of outdoor things in LA. It's nice and warm. You're still eating outside. So I think any city is tough, but I don't think that's a hard city to navigate right now. I think it's okay.
And would you say that the same information you're sharing about airports and airplanes applies to train stations and trains? Because I have heard of a lot more people doing train travel also.
Yeah, train is fun. Amtrak does great trips from Penn Station. We use Amtrak Vacations sometimes. I mean, they're great. You just have to kind of, it's a little more crowded, I would say, a train station. So you have to be a little more aware of what's going on around you, but the same protocols. People understand now. The train travel has the same thing with the business class versus regular class versus, all that, especially in Europe. In Europe, they have really fancy first class. That's not that much more money. It's amazing that you could, for a few extra dollars, be in a premium car, I always say it's a little special because train travel is so nice. I think train travel sometimes is easier. You don't have to go through the security line standing in front of people. You don't have to deal with the checking of a baggage. You bring your right. So sometimes there's less people touching your things so train travel is doable. It's like the same protocols. We have to be a little more aware, but there's no COVID protocols to get on and off a train. That's the big difference. There's nobody that has to upload anything to get on or off. That's the difference.
I see that question in the chat about what travel insurance you recommend.
So I book Travel Guard a lot, which is AIG sponsored. They're very, very good. They have about 4 levels of plans, starting from basic that covers everything at pretty much 100% to premium. There's 4. They change different things. Back in the day, it was gold, silver, bronze. Now it's Travel Essential, Travel Plus. So I like Travel Guard a lot. They price very well, and they print out. So I buy the policy. They send you the policy. You take your card with you when you travel. If something happens before, we could file the claim. If something happens during, you could file a claim. Loss of luggage, sickness. One of my clients got stitches in Jamaica, fell. One of my clients had to be medevaced out of the Dominican Republic. Things like that. They're very easy to deal with.
And they cover the medevac? If
they covered a percentage of it along with the person's health insurance. So that's a big, big thing. During the pandemic, an insurance came out. It's very expensive. So I kind of hesitate, not that I hesitate to offer it. There were some people that wouldn't take no for an answer to travel, even though they knew the risks of coming home. It was more of a quarantine when you got there. There were bigger things a year ago, even 18 months ago. A company came up with this COVAX global insurance. They would come and get you and bring you home if you didn't want to quarantine in the country. It was a very expensive insurance policy, but some families took it. They just couldn't stay home. It was an expensive policy. So there are medevac situations, but even the regular policy should always have that in there. And an evacuation for different reasons, and a terrorism there's all kinds of things. If you get sick, if your travel partner gets sick, if a lot of things, war, things that we're dealing with, they're real things.
I see Robin has a question, but just to follow up on that, I just heard recently of someone who, it was actually a friend of a friend's teenage daughter was on one of those spring break to Bahamas trips. And to come back, they had to test everyone, 8 girls were there together. And one of the girls tested positive on the test that they gave. And it was very, very stressful in that situation. So what would be the options, if you can just talk through a little bit, what would happen if someone did test positive in a country, that they were out of the country? And what is advice for that? Because, for a few things, what if you are the only one of your party that does, first of all? So it's not like your whole, crew is staying there. The added expense, the medical situation, all of that. So if you can kind of talk through that scenario a little bit.
That was another thing that I didn't go to school for that happened a lot during the last 2 years. We had clients test positive in Turks and Caicos that had to stay 10 days. At that point, it was a 10-day quarantine. You had to stay 10 days. Their insurance fully covered it. They took big time, not Kovac, but they took a good insurance policy. They were there over Christmas. They tested positive. Their daughters didn't. They had 2 rooms. Their daughters left. They stayed. Turks and Caicos was very, very strict. They actually had the hotel making sure they did not leave that room. It was, I don't want to ever say it's bad to be quarantined in Turks and Caicos with a balcony, but they stayed. The expense they had, they fully put in for a travel claim when they came back because they had insurance. I don't know how much they ended up getting back, but they did not complain to us. They were done. We've had people test at resorts who had a family member stay with them, like one person test positive. Right now, it's different, it's changing. Back when travel started again, most of the big resorts, like I'll just name Dreams, they would allow you, if you tested positive, to stay at their hotel free for 10 days. They felt that it was better to bring people back to travel and sacrifice something like that for the few that might test so they could start. And they were very serious about it, though. They have health centers testing. They have areas that only people test, that you're not with everybody else. There's like one building, you stay. Beaches had it. They all had it. Now, as that's evolved, and more people got vaccinated, so less people are testing positive coming home. I've heard ridiculous stories of people swapping tests and, getting themselves back home, which is not fair because then you're flying with somebody with COVID. But it's becoming less and less because less people are testing positive. But that's why the trip insurance is important for the extra, like sometimes when I book newlyweds, it'll be an extra $160. I say, I'm just going to price this with insurance so it's part of the whole thing. And because that would cover you. It would cover you up to a certain expense. It would cover you up to, say, $10,000. They know that might happen at all the better hotels, I know some countries weren't so great with it, and I can't specifically remember certain clients that just tested positive. It was like, boom, they got sent to some hotel. But that was really when it was the height of being worried. But you would be taken care of. On a cruise line, I think you'd probably be put in some, really way back stateroom. They still have to have them available where you can quarantine.
I see that in the chat, my kid tested positive at the beginning of our Costa Rica trip. Thank God, with the long time being there, we all tested negative before flying out.
Exactly. And it's funny because you get nervous. Sometimes people test, there still is that small percentage that someone who might test positive that doesn't have COVID, that small, you don't know. And that's why they gave that waiver of people that had it. They knew for 90 days you might still test positive, but you had to be fully recovered and out of it for at least 2 weeks. So, and a doctor has to say they're capable to travel.
I actually was going to ask about the COVID hotels, so you beat me. You beat me to it. Maybe one other question is there
Sure.
any island for a person that is compromised that you would say don't go to?
Oh, yeah. Don't quote me, but
Okay.
What's
Just
so
because
funny?
if you have to be hospitalized or if
Yeah.
you need any kind of medical
Well,
care, even before COVID,
well, I'm going to be really honest with you. And I've traveled to most of these because I think selling travel, I need to see it. And we went to the Dominican Republic. I went twice this year, getting all kinds of chatter that the Dominican has the worst. They're the worst. The food's the worst. I had such a nice experience. It was such a lovely, I stayed in such a nice area. But my mother-in-law broke her hip there. And it was terrible care. Terrible.
Right.
It could have been the situation but I really don't think I could put a stamp on a country that's poor. It's poor.
Right.
I had an experience in Jamaica it was fine. It was doctors that were American trained in Jamaica. It was totally easy. Mexico, before COVID was booming, there's been no entry requirements for Mexico. I don't know if they're just not reporting their numbers, but I don't know anybody that came back sick. I don't think the Mexican hospitals are something I would want to be in, but I would go to Mexico tomorrow if somebody asked me. But I just don't think medically, if I had something wrong with me, it would be where I would go to, because I don't think they're up to, maybe at Mexico City, they're a little better than in Cancun.
Where does Aruba fall on your list? Where does Aruba fall on your list?
Aruba is really good. Aruba is very popular right now. And because you have so much travel there, they're very up to snuff with everything and care and no complaints. And they did not let people in right away. They were very tough on who could come in that country. And then they opened up. They're good. Aruba is very good because you have a lot of choices. Bermuda is really good. Turks and Caicos, excellent. I hate to say that about Mexico because I love it, but I'm just being honest. Same with the DOR. I loved it. I would go back tomorrow. I just don't know how the facilities would be. Let me think. St. Lucia, Antigua, they're good. They're just a little more like not up to what we have here. Hawaii is okay. It's a long haul. Hawaii is fine.
So we had another question that someone who couldn't attend emailed, and I actually had shared this with you earlier. She's asking for tips on handling anti-vaxxers along our travels. I know that my stepbrother and his family are not vaccinated. They aren't staying in the same house as us, but we will be spending time with them and their 2 kids. So the cousins are finally able to meet. Also, how often should we be testing for COVID along the way, and how accurate is the testing? This is very specific. I'm just going to read them. Fly from Denver to Florida to see my family, 6:30-376, then fly to Boston to see my husband's family. His siblings will be flying in from Portland, Oregon, and Oakland, California. The 4 siblings haven't all been together in the same place in 4.5 years, so I don't want to stop it from happening, but I also don't want to get COVID for the 3rd time. I've already had Delta, and this is cancer, survivor. So
yeah, wow. It's really sad, but I know that when people get together for weddings and things like that, it seems to be where the spreading is happening. But if they're going in the summertime and you could be outside, as well as I do, the more things you do outside, the better. The family should kind of all have their family space and not that they can't share food, but not be all into each other's dips and things like that. I think, especially when you're being like that, be careful on the plane, do your masking on the plane, because you don't want to get there and have contracted something from somebody along the way. So I would say getting there, be really diligent. And I would test. I would maybe test on arrival. I guess maybe that you might know this, Rachel, a little better than I do, just dealing with cancer patients. Sure. Maybe test before you get on the plane. I don't know how many times you have to test. It becomes kind of, I think, redundant. But they should all be COVID-free when they meet at that 1 or 2 places. And then I would say try to do outside dining and hanging out as much as you can. Other than that, it's hard to know because a lot of people don't get it either. Yeah.
We had, for our last COVID and cancer medical update, when we had Dr. Cardi Smith, who came, it was actually right before a lot of people were doing holiday travel and holiday gatherings. And I actually took a lot of my cues from her. And we went over, my kids had break in February, so for President's Week, and we were visiting my parents in Florida. Oh, yeah. My dad is immunocompromised, and we actually ordered the tests and had them sent there, but we used those home tests every single day before we saw him, because, I figured if the goal is to keep him safe, not that I obviously I didn't want my kids to get COVID, but the goal was to keep him safe. And we did it as close to the time we were seeing him as possible. So if we were seeing him for dinner, we tested right before. If we were seeing him in the morning, we tested right before. And we did it we literally did it every day. We were there for 7 days or something. And it was kind of expensive, because we had to pay for some of the tests, but it definitely gave me peace of mind. And we also while we were there, we tried to socially distance as much as possible. So as you said, we only ate outside. We didn't the majority of our visiting outside. The one day that was rainy and we were inside and we went to their apartment, we opened up all the windows, all the sliding doors, and then we wore masks except for when we were eating. So I mean, again, this was my personal level of comfort, but
Yeah.
you know, kind of do what you
And you have to put it out there to your family. Like my daughter in the beginning of it, just having all the things she has, you know, it was a big deal. Like, you're going to wear a mask around her. Like, you're not, I don't care how long you've seen her. And we did a lot of testing too. So I think that, you know, they just have to be on top of it. And then when you test and you know in that moment that you're negative, you become a little more calm to have a good time. And it's hard to bring all the families together, but I think they should be okay. It's hard with the non-vaxxers, but it can work. The testing helps.
I've definitely seen also, even with vaccinated people, I've gone to a few larger gatherings lately, weddings and bar and bat mitzvahs, and people are saying that they want a negative home test, even if you're vaccinated, which I think is it's kind of a newer thing that I'm seeing.
Yeah.
Makes sense. I was wondering, in terms of a question, you mentioned before, I thought that was interesting, about the different accommodations people can get in airports. And again, not specifically even related to, you know, just during the pandemic, but for our patients who are cancer patients or survivors or might be traveling with someone. Can you talk a little bit more about what the various accommodations are, how to request them, and really how to make airports, you know, as comfortable, stress-free, and safe as possible?
Sure. So I have a lot of airport experience. I do for my clients. You can request almost anything specific to yourself on a plane. If you're going internationally and you need certain dietary needs, I'm celiac. I often have to ask, just if it's a long haul flight and they're serving anything, like they don't really care when they're handing out nuts anymore. I don't know why. They hand them out on every airline. It used to be so they couldn't do that. I can request dietary needs. I can request any handicap needs. I mentioned my nephew has Asperger's and autism. They let me get him through the gate once, but they made him sit in a wheelchair. They let me go, and he was so embarrassed, but he did it because I wanted to attend him to the gate, because the first time he flew alone, he was about 12 years old. I could put in wheelchair requests for someone at check-in, like right at the counter, all the way to the plane and on the plane. Or I could just do from the, you know, anywhere you want. You could request a vehicle to bring you all the way to the gate. I used to get my mom all the time a wheelchair when she traveled alone, and said that the person had to stay with her because she was getting very fragile and she wanted to go see my sister, and she was sick. She had CLL and COPD. You can also do any kind of hearing or vision requests. Like I said, you can alert the flight staff to know that you are either deaf or hard of hearing or visually impaired, because if something happened on a plane and you can't understand what's happening, that the flight attendant should know that there's a few people they need to go help. There is also, I'm just trying to think, I do it. Oh, a lot of times I can get accommodation with seating. I mean, I can't promise it, but a lot of airlines hold back seats till the last day for someone handicapped. Like, I've had people that have gone somewhere and had surgery and come home. I flew next to a girl that must have had some kind of procedure that was in a lot of pain next to me, but they brought her on first. They set her up. This was all the flight staff. She didn't have anybody flying with her. They helped her get settled down. I flew with her. I felt so bad. And she was coming back from a surgery. But they can do that for you. And you really just have to ask. It's hard to get in touch with these airlines, but there's a lot you can do once you get into your specific, like when you do manage my trips and you go into the screen, there's a lot you can request, and there's a lot of travel consultant can help you with. That being said, if you forget that you wanted this accommodation, you can always go to the airport, and at that check-in, I know it's a pain to wait in the line, but if you have to wait to do luggage, you can always ask them there, and they should be accommodated. Those gate agents, and when they check you on the computer, they have the most power of anybody. They really do. They could change your flight. They could give you a better seat. They could put your TSA number in if you forgot it. They could do your frequent flyer. So you could say, oh my gosh, I didn't put in that I'm hearing impaired. They could do that. Can I please have a wheelchair? Good luck if you're in West Palm Beach. I feel like when I fly there, there's about 50 wheelchairs and me on a flight. It's just that's how, it's senior citizen land, which is nice because everybody's still traveling. So yeah, you could do a lot more with, health help and assistance.
How are you?
Good. How you doing?
I know most of this information is centered around travels, but for me, I am a cancer survivor. My husband is also a cancer survivor, and we have all the chronic diseases that you could think about. And so to be in an environment, you're not in your own space, you have no control as to who comes through the door. And so you know that you're wide, you're exposed to, there's a possibility that any one of them could contaminate you. And I'm so concerned because I cannot afford at this point in time, to be careless, to be carefree. If you feel that you don't want to take the vaccines or whatever, it's a personal choice. But
Absolutely.
we can also think about other people. Would my actions affect other people? And so I'm just so thinking about the negativity of this art, because I know that where we are right now, it's not safe. It's not safe when it comes to getting COVID. I'm just overwhelmed at this time because you're sharing a wealth of information, but how would I apply this if I don't have any control over it?
I think that you're making a really good point. I think, it seems like you're talking about almost I don't want to say disrespect, and that kind of goes back to the question that someone emailed. How do you handle people who don't have the same values that you do when you're, whether you're traveling, next door, to go to a barbecue with neighbors, or whether you're traveling, to the other side of the world, and I think that it comes down to almost like respect for your fellow human beings. And unfortunately, that's not something that we see enough of. And so I think, kind of going to Virginia's point, I think the best thing that you can do is make the decisions that feel comfortable for you and spend time with people who you feel comfortable with, and know that they have similar values. Just as an example, I have a very good friend who has been very, very cautious. She has 2 young children, and she's just, her personal belief, they've been super cautious. They really did not socialize, let their kids did Zoom stuff, but they were extra, extra cautious. And she has a friend, we live in Manhattan, and she has a friend in her building who does not believe in vaccines. And their friendship has almost ended because, first of all, there's this kind of fundamental difference, in their belief system, but also not just that, there's been no way over the past 2 years for them to get together in a safe manner, and I think what you're talking about is more than just travel. It has to do with how you make decisions about how you're spending your time and who you're spending your time with. And I think the question that was emailed in that we read, where this patient was talking about the fact that she, that she wants to spend time, the families haven't seen each other in so many years and they want to get the children together. However, they know that they are not vaccinated, and how can they still do that safely? So you need to weigh the pros and cons of a situation and decide what feels most comfortable. But it's a really good
For yourself. Yeah.
Yeah.
Thank you.
We are about out of time, everyone. But Virginia, this was so helpful. If you don't
So nice to meet all of you.
Yeah,
it's really nice.
Really super helpful. And I'm so glad it was kind of the perfect size to have everyone get, whatever individual questions or issues, answered. And thank you for being so generous with your email and your contact information.
Oh, yeah.
If anyone does have specific questions for Virginia, if you want to just reach out directly to the woman to woman, the woman to woman at mountsinai.org, email the one that we send out all the reminders from. I'd be happy to connect you if you have any follow-up questions or questions that didn't get answered. But
I'm going to email you, get that to you in a few minutes.
Thank you so much. I appreciate it.
Thank you for having me. I mean, I think you guys are all amazing, all the survivors and everybody going through it. I went through it with my mom and my sister. So you're a great group.
Thank you so much. We really, really appreciate it. You have so much knowledge, so much expertise to share. And, hopefully you all feel a little bit more empowered to make whatever decisions that you decide to make right now, whether it's staying home and, and Zooming or taking some sort of more exotic, trips right now. And look forward to hearing about it. So have a great day, everyone.
Thank you.
Thank you, Rachel. Thank you.
Thank you very much.
Rachel. Bye,
Thank you.
everybody. Thanks.
Bye.
Everyone.
Good.